Hello, Dr. Vivek. Good that I have found you here. I know that you are a pulmonologist. We all know that there is some serious work going on behind these walls. As pulmonologists, you people have been doing incredible work to save people from this deadly virus. Can you just share some knowledge?
Absolutely, sir. Absolutely.
And
It will be my pleasure.
like it's a very tough time.
Yeah.
We all know that. And you, as a pulmonologist, are doing your level best, battling for all your people who are like admitted in COVID ward.
Yeah.
Sir, uh, it's really cumbersome to wear this mask and talk, but can we just come into our lounge and talk about COVID?
Sure, sir. Please,
Sorry,
please,
what?
please.
And this is one safe area where we can just remove our mask, sit and talk. It's really very good to have you here, Dr. Vivek. Maybe you can remove your mask since we are in a safer area. Could you just tell me how many people are you seeing with COVID nowadays every day?
Sir, right now the OPD ranges anywhere between 50 to 70 patients per day.
Okay.
TOPD I'm talking about.
Okay.
They're relatively stable, not really getting very, very sick, but there are, because the numbers are pretty high,
Okay.
even if you consider even 1% of the patients who are relatively sick, that's a pretty big number.
Okay.
And that's a pretty big number. The number of hospitalizations also will be pretty high.
Okay.
But the good thing is that they are recovering well.
Okay.
Most of them, at least. However, we need to be a little bit careful regarding the patients who are at high risk.
Right.
Because these are the patients who worsen if not treated early,
Okay.
or if not taken care early. Per se, for this disease, other than symptomatic treatment, nothing significantly is necessary.
Sir, let me put a question this way. Sir, you come across a patient who is RT-PCR, whose RT-PCR is positive or who has symptoms. How do you say Omicron, Delta or what? How do you start with doing a RT-PCR or how do you proceed with your protocol?
See, sir, the thing is that there are multiple tests which are done these days. There is the rapid test which people come over with, and then the RT-PCR. The rapid test doesn't detect or differentiate anywhere whether it is Omicron, Delta, or any other variant. The RT-PCR does, but that needs to assess the S gene.
Okay.
There are multiple genes in which multiple mutations takes place, and the RT-PCR detects multiple genes. Previously, before this particular Omicron variant had come over, we were not really assessing the S gene, but Omicron has shown S gene dropout. The difference between a Delta variant and Omicron variant is the S gene dropout. There are a few RT-PCR which does do a screening of the S gene. However, to confirm the report, we need a genome sequencing. If the S gene in your RT-PCR is not
Absent?
detected, is absent,
Okay.
or is shown a dropout, then it is likely that you actually have Omicron.
Okay.
To confirm it, you need genome sequencing.
Mm-hmm.
However, as we say this, there have been reports that there are certain subvariants in Omicron which also show S gene being positive.
Okay.
So, anyways, that is as we go about, we'll understand the disease more further. As of now, as an overall picture, you need to know that Omicron doesn't show the S gene, whereas Delta shows.
Okay.
Reason for us knowing now. The question could be, why do we need to know whether it's Omicron or Delta?
Right. That's $1 million question nowadays.
Yeah. So, particularly, sir, for treatment, it really doesn't matter whether it is Delta or Omicron. Only thing is, for high-risk patients, the antibody cocktail, which is right now very, very popular and probably little overused, is only active for the Delta variant.
Oh, is it only for Delta variant?
It is only for the Delta variant. The antibody cocktail which I'm talking about is the Casirivimab plus Indevimab, which is available in India.
Okay.
There is an antibody available for Omicron also, but still not available in India.
Okay.
So the antibody cocktail which we are giving in India is only valid for Delta variant.
Okay.
And it only works for Delta variant. Also, the indications need to be very clear. The indications for giving the antibody cocktail is not that any person who has Delta needs to take it.
Okay.
It is a high-risk patient who is coming within the first 1 week of illness, not very hypoxemic and symptomatic. It is in these patients that you need to give the antibody cocktail and not otherwise.
Okay. And suppose this patient turns out to be a Delta.
Yeah.
He doesn't have an S gene in his RT-PCR. So how do you manage him?
So if the S gene is not there, that means it's Omicron.
Right.
Now, if it's Omicron, generally you just need symptomatic treatment, most of them, sir.
Right.
However, there are studies for high-risk patients where you can give early course of remdesivir for a 3 to 5 day course, which might help disease progression.
This is for both the groups? No, you're talking about this protocol for both the groups or only for Delta? Giving remdesivir?
No, this is for, see sir, remdesivir acts for
Both.
any COVID purpose. Right. So, I mean, at least most of the studies show that remdesivir does that, and our experience shows that it doesn't. So, when you give remdesivir, it is both. It is for both. It is for
Right.
Delta and Omicron. For Delta, there is one better treatment available, which is the antibody cocktail in early disease.
Okay.
Followed which remdesivir is a good treatment. But for Omicron, because we do not have certain antivirals available in India, that is called Paxlovid, and the sotrovimab, which I told, the antibody cocktail, the third best treatment is remdesivir,
Okay.
a short course in the early disease.
Mm-hmm. So in case somebody has got his RT-PCR done and it turns out to be Delta, so should they adhere to the same protocol, or is there anything else going for ICU admission apart from the regular treatment? Should they take this cocktail in the hospital, or can they take it at their home? How are you doing that?
So,
and how much does that cost?
Yeah, so basically the antibody cocktail is only, as I said, for high-risk patients only. Not everybody of Delta needs an antibody cocktail.
Okay.
So we have to be very sure whom are we going to give antibody cocktail.
Right.
Because the antibody cocktail is very expensive.
Yeah.
Per person, that vial is almost 60,000.
Okay.
So it's a pretty expensive agent,
Mm-hmm.
and it's a very effective agent.
Mm-hmm.
So we need to see that we give it to the right people
Mm-hmm.
who we think have a chance of progression, and not everybody else.
Mm-hmm.
Most of them, sir,
Mm-hmm.
do well with normal symptomatic treatment.
Okay.
Maintain good hydration and take symptomatic treatment. Most of them should be okay.
Okay. And how frequently should they check their saturation, and what is that cutoff point when they should come to the hospital for admission?
Ideally, I have asked my OP patients to check it 8 hourly.
Right.
During the first 1 week to 10 days of illness. Depends upon whether they are symptomatic or not symptomatic. If they are not symptomatic, I don't tell them to really bother.
Okay.
First initial few days I tell them to check, because sometimes there was something called happy hypoxia, which was predominantly seen in the first and second wave, not per se in the third wave. But however, it is a good idea to keep checking your saturation. That doesn't mean that you keep on checking the saturation every 10 minutes, every 15 minutes. You just panic even if the saturation is going by 1 point. I've seen many patients doing that. So every 8 hourly probably is a good idea.
Sir, one last question. Sir, could you just tell us what stops this virus from spreading?
It is something which we all know. We've learned, we've read, we were asked to practice. Most of us have practiced, but few of us haven't. Hand hygiene, social etiquettes, wearing a mask regularly, avoiding gatherings, crowds, rallies. These are really, really important to stop the transmission of the disease. And having a good immunity also. This is what is really important. This is the only thing which will help. All these treatments are just a supportive, a supportive therapy for COVID. It is only when you prevent the disease that you can actually be away from the side effects or hospitalizations, because every drug carries its own side effects. What I really feel is, if you prevent the disease, it's the best for you, and then you and your family can be pretty happy.
Sir, one last say,
Yeah.
your say about the booster dose.
Please take it.
What do you would you suggest?
Absolutely. I totally suggest the booster. Every person has their own thought process about the vaccine. One thing what we have seen, which we were not seeing in the first and second wave, is the intensity of the disease which has come over. There are many Delta variants we are still seeing, but they are not that severe. Why is it not severe? What is the difference? One thing what I can see is they were not vaccinated earlier. Now they are vaccinated. So definitely, vaccine makes a very big difference, according to me. And you should take the vaccine. And also, the people who are properly vaccinated, I would suggest you take a booster because it definitely decreases the intensity of the disease, decreases the number of hospitalizations. I'm not saying that you may not get the disease at all. There is still a chance
the
of getting the
severity
disease,
must
but the
be
severity will be
very
much
mild.
lesser. So definitely, it is.
Sir, would you advise people who have taken first, second dose of one type of vaccine to take the similar type as a booster, or would you advise a cross?
See, Satyavs, they have been a lot of papers which have shown that mixed match is a good option. But however, there are no certain guidelines and protocols which have been said that you can take a different vaccine altogether. So till now, our government follows that the booster needs to be taken the same vaccine what you had taken earlier.
Okay.
However, there have been a few studies which show that mixed match of vaccines is a better option. However, because the government protocol says that we need to continue the same vaccine, I also suggest at least you take the same vaccine.
Thank you so much for talking to our people and sparing your valuable time.
Thank you.
And I really appreciate the kind of work you have been doing. I have been seeing you for the past 2 years, like how you are like working during that second wave and how you were before the first wave. And before the third wave comes, let's take all these tips from Dr. Vivek Toshniwala.
All the best and take care.
Thank you for watching this.
Yeah.
Thank you. Welcome to Med Talks with Dr. Moin.